Malaysia is a truly blessed nation with a dynamic and diverse society that continues to build towards greater levels of success. The Malaysian AIDS Council was formed in 1992 upon the initiative of the Ministry of Health. Its primary goal is to coordinate activities and resources of HIV and AIDS related NGOs under one umbrella. The Malaysian AIDS Foundation was formed as a fund-raising entity to complement the efforts and ensure the continuous success of the activities and programs of the Malaysian AIDS Council. Since Malaysia's first reported case of HIV in 1986, many new cases of infection have been reported, and statistics show that HIV is on the rise in Malaysia.
The Ministry of Health began reporting HIV/AIDS cases in 1986. Since then, thousands of HIV infections are reported in Malaysia every year, while thousands have already died from AIDS. Lack of awareness and knowledge about HIV transmission is one of the contributing factors to the continued spread of HIV in this country.
Continued efforts to educate the public are essential to reduce discrimination on people living with HIV. Many times, ignorance has caused people with HIV and AIDS to be discriminated, especially in the workplace. Without proper labor laws protecting people living with HIV, many risk losing their jobs, caused by baseless fears surrounding the disease.
Stigma remains the key barrier to tackling the HIV epidemic in Malaysia. It is the main reason why many people are afraid to step forward to get tested or even seek treatment. They fear the disgrace and humiliation associated with the virus, thus hampering all efforts to curb the epidemic. We, as one Malaysia, should stand up against stigma and discrimination and work together to prevent the virus from devastating our society.
The new batch of antiretroviral drugs has been proven to have fewer and milder side effects, and this allows people living with HIV to live healthier, more prolonged and productive lives. We need to impart this information to the general public through awareness and educational programs. Importance is also placed on the support from corporations and governmental bodies in providing funds to ensure the continuing universal accessibility of the antiretroviral treatment.
Thankfully, many corporations have started to change this perception and have implemented policies that handle issues pertaining to employees with HIV. This is an important step to ensure a fair and progressive environment is sustained within the workplace.
With more than 4,000 new HIV infections reported yearly in Malaysia, we cannot afford to turn a blind eye on this pressing issue, as HIV does not discriminate against race, gender, and social status. The universality of this issue should affect the general public just as much as it does the people living with HIV themselves.
Over the years, the Malaysian AIDS Council, with its partner organizations, has reached out to the public through events, functions, media communication, and lectures to raise awareness and educate the public on HIV and AIDS. Our dedicated staff and volunteers have ensured excellent teamwork and results on implementing various tasks to their success. Therefore, to ensure excellent work, adequate funding for the Malaysian AIDS Council is crucial. To ensure accountability on fund management, the Malaysian AIDS Council's accounts are audited annually. Transparent funding mechanisms assure all funders of effective and accountable implementation.
Satu penghargaan buat Siti apabila diberi kepercayaan memikul tanggungjawab sebagai selebriti sokongan Ribbon Merah Majlis AIDS Malaysia untuk meningkatkan kesedaran, berkongsi pengetahuan serta menyokong usaha-usaha pencegahan HIV/AIDS di negara kita.
We believe that the success of our work depends on partnership with various players. Many of our programs have been highly successful with the generous support from corporations, government agencies, the media, and religious bodies.
I believe the power of traditional and mass media plays an important role in confronting the health and social issues of AIDS and HIV. And as a media practitioner myself, I fully support the Malaysian AIDS Council and the Malaysian AIDS Foundation in addressing the issues on HIV.
With their support, we achieve greater success in our work at the Malaysian AIDS Council. We look forward to you coming on board to join us on this worthy cause.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Greetings of the day and salam satu Malaysia. It is indeed an honor for me to be the patron of the Malaysian AIDS Foundation. In the 3 years that I have been actively involved in this cause, I have seen the foundation grow from strength to strength. Funds raised to support various prevention programs and the Malaysian AIDS Council have helped make a difference in the lives of those infected and affected by HIV and AIDS. A milestone for Malaysia with strong support from the Ministry of Health is the full subsidization of first-line antiretroviral treatment available at government health facilities. Some efforts to scale up our national response to HIV and AIDS are awareness campaigns to the general public and implementation of various research initiatives to better understand the epidemic. However, the threat posed by the epidemic in Malaysia still remains as large today as when it was first reported in 1986. Stigma and discrimination still remain a major deterrent for Malaysians living with HIV to seek treatment for fear of being ostracized. For that very reason, the Malaysian AIDS Foundation would like to reaffirm its dedication to combat stigma and discrimination. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi ta'ala wabarakatuh, and thank you.